Doctors and nurses, what was the craziest example of someone stupidly making their condition worse? Patient here. I got an itch in my eye one night and figured my contact had dried out. I went to remove it, but the damn thing was stuck in my eye. So I started pinching hard, trying to get it off, and then my vision went all wacky and my eye started to really hurt. Gave up and went to the ER because I couldn't see. Turns out my contact had fallen out before the whole process started, and I'd been scratching the crap out of my eyeball. Had to wear an eye patch and put in some very unpleasant drops for a week or two. Oops. Next story. I was a nurse for 20 years, but this is a story about my husband. The man has a very high pain tolerance and is always hungry. So one day when I met him for lunch, I was worried when he wouldn't eat and said his lower abdomen hurt. I talked to a doctor friend and husband was sent for an immediate CT scan. Husband was sent home to wait for the results. So, being him, felt better and ate 2 chili dogs with Fritos. Of course, when the doc called and told him to get to the hospital now because his appendix was about to rupture. Husband had to be kept in a holding pattern for 12 hours because he's eaten a big meal. I may have shouted at husband a little bit that day. Next story. I saw this young guy in the ER once who had gotten into a drunken brawl with some guys at a bar. When he woke up the next morning, he started getting some vision changes. He said that it was like a black sheet coming down on his left eye. This is a textbook symptom for retinal detachment. Picture an incredibly thin, delicate membrane on the back of the eye, slowly peeling off because of trauma. It's an emergency in ophthalmology because if it fully detaches, you get permanent vision loss. You basically need to immediately go for surgical repair, and then be extremely careful with that eye for weeks afterward. You even have to keep your head down most of the time for the next couple days to help the reattachment process take. So naturally, this guy goes and rides roller coasters all day at the local theme park with his buddies. He first presented to our ER 2 days later with permanent vision loss in that eye. Six Flags was not worth it. Poor guy. Next story. Surgical nurse here had a patient return to the OR who had some hardware, plates and screws, put in their elbow for a fracture. The hardware was causing them discomfort, so instead of talking to her surgeon, they decided to remove one of the screws with a knife and screwdriver. I got the case for a wound cleanup and replacement of said exposed screw, one of the strangest ones I've had yet. Yeah, I've never heard of this before. Why would anyone even consider this? That sounds horribly painful to unscrew an implant that you have inside of you. Like, come on. What did you think was going to happen? Now you're going to get an infection on top of that. Next story. I used to work at an oral surgeon's office. A patient came in needing a tooth pulled, and because the root was near the jaw, they needed to remove it under anesthesia. The patient did not want to pay for the anesthesia, $350, so he decided to try and take it out on his own. He used plies and ended up breaking his jaw. We had to go and fix his jaw and wire his mouth shut. Ended up costing him $9,000 instead of $500. Next story. I'm a tech. This fairly large woman came into our unit with type 2 diabetes and diabetic ulcers all over her lower legs, toe amputations, and a wound that would not heal. Her husband frequently visited her, and just before my shift, brought her 6 tubs of the chocolate Pillsbury frosting icing because of her sweet tooth, and they have insulin at the hospital to match the sugar. When I stopped to check on her, she had already finished tub number 4 and said to me, quote, "But I'm already at the hospital, I might as well." Shaking my head. Yeah, lady, no one ever dies at the hospital. Next story. I had a client with a stroke who received TENS treatment and rehabilitation, really low electric impulse to stimulate muscles and nerves. After rehabilitation, he was offered to get one of the things for home use, completely free of charge/costs. He refuses because filling out the paper, 1 page, was too much work. He decided to just use what we had at home and tried using a transformator/transistor for this therapy. That completely destroyed the small amount of nerval function we had achieved in rehabilitation and screwed up his condition a lot. Do not try this. This hurts a lot. Next story. Not a doctor or nurse, just the niece of a man that, after having surgery performed on his gut and being told not to eat anything for the next 24 hours, decided to get chili cheese fries at Wendy's on his way home from the hospital. He went right back and his condition worsened. Also, my fiance's mother is a nurse and told us that a man came in once with a tiny garter snake up his urethra. It had been there for weeks before he came in because he was too embarrassed to admit he let the snake go exploring on purpose before it got stuck and died inside of him. So he promptly died of septicemia. Yeah, that's a heck of a way to go. A snake literally climbing up your pee hole and yeah, boom, you're gone. Yikes. Next story. Male patient was in for dehydration and other very routine issues. He had an indwelling catheter placed. Now, an odd thing about some men is that they cannot wrap their minds around not standing up to pee. So even though he couldn't feel any urge to urinate, he stood up to pee. Felt the catheter, forgot why it was there, and promptly ripped it out. Now he's incontinent. Another patient was in recovering from surgery. I think it was knee/ankle, something that required she use a walker while recovering. She decided not to do that and test her leg. She fell onto the floor and broke her hip. Next story. Not a doctor, but I had a stress fracture in my foot that had to be surgically corrected. I was given a 60-day supply of Vicodin, but my now ex-husband was a recovering alcoholic who had me convinced I was going to become horribly addicted if I took them for more than a couple days. So I began taking a leave because it was stronger than Tylenol, and I only had to take one a day. My foot was very slow to heal, like a couple months go by instead of the usual 6 weeks. I had to get a CT scan, and I was very worried because this small little fracture just wasn't healing. My doctor asked what I was doing for pain, and I told him about the Aleve. Turns out, NSAIDs interfere with bone healing. I cut out the Aleve, and my foot healed a few weeks later. Next story. Not a doctor, but my sister and I go Christmas shopping. She's newly pregnant. I can tell she's in pain, and it's getting worse. She claims it's just gas. She thinks all stomach pain is gas. I offer to take both carts to check out while she sits for a bit. At this point, she's vomiting. I'm pretty worried and tell her I think we need to go to the hospital. She insisted it was gas, and she had a doctor's appointment the next day, so she'd mention it. Next day, she has an ultrasound before OB appointment. 5 minutes in, she calls me and says she doesn't know what's happening, but they told her to get dressed and not to move. She hears them call an ambulance. Ruptured ectopic pregnancy with internal bleeding. She's fine though, ended up pregnant again 2 months later with my nephew, but she still doesn't learn. After weeks of her sick and looking like death, I convinced her to go to her doctor last week. She has pneumonia. Next story. Nursing student here. Female patient had an indwelling catheter to help void her urine. She had fluid overload from heart failure. I was at the nursing station giving my co-assigned nurse a report when I saw my patient walk up to us and start speaking to us in Greek. It took me about 2 seconds to realize that she didn't have her walker with her. Another 2 seconds to notice she didn't have her catheter with her either. I walked her back to bed and saw the catheter attached to her bedpost with the balloon still fully inflated. Next story. It was certainly a self-inflicted condition. Old guy in for rehab after some kind of orthopedic surgery, taking warfarin for DVT prophylaxis. His INR, a clotting time test basically, was coming back out of whack time after time despite dose adjustments, and nobody could really figure it out. Went in his room on some routine task and saw a large pill bottle on the dresser. Turned out to be a herbal supplement containing, among other things, garlic, ginger, and, if I recall correctly, ginseng, all of which interact with warfarin to make it more effective. Guy's wife took pills home. Guy lectured on, please run even OTC meds past your doctor because you absolutely did this to yourself. Labs normalized. Next story. Obligatory not a doctor. I'm an optician and an optometrist, and so many semi-blind people refuse to get glasses because they don't want to spoil their eyes. They come back 6 months later with migraines and complain about not being able to drive in the dark or read, and get angry because their eyesight is not getting better, although they're always training their eyes. It doesn't work like that. Next story. Nurse here. The condition was not worsened by the patient himself, but his choice of life partner certainly did not help. Patient was utterly ravaged by advanced cancer. Several doctors have told him and his wife that his condition is terminal. Patient seemed to understand when he was lucid. Wife said she understood as well. He was in hospice for comfort. One night, he had trouble breathing, as the dying tend to do. Wife called 911 against patient's wishes. Thus began a 3-week, pointless and painful ordeal that involved life support, dialysis, and at least 1 round of CPR on a man whose bones were riddled with metastasis and diarrhea. Wife was adamant that he will get better through holistic medicine. On top of being in denial, she was dumber than dirt. She filled the intensive care room with all sorts of new age things like inspirational pictures and rocks. She even refused pain medicine because it would, dim his chakras. Wife left a crystal geode on the bed. Crystal worked its way underneath patient's hip. Patient developed a raging bed sore that never closed. Was nearly always soaked in feces and was a female dog to dress. On a patient who wanted to die and was in already excruciating pain. This was years ago. Still, I can honestly say I hate that woman. Next story. My wife, nurse, has seen on more than one occasion a person on oxygen or emphysema blow themselves up with a cigarette. She said, sometimes it's funny, like Wile E. Coyote funny, and they're not injured, but sometimes the injuries are quite severe. Next story. Had a patient come in and had accidentally stuck a chainsaw in his leg the day before. He managed to cut the fibula, I think, and partially cut the tibia. He put some diesel on it and wrapped it in duct tape and kept working. The next day, he steps off something and it snaps the rest of the way through. Came in the front door with his leg flopping/bending where it shouldn't be. And to top it off, he rated his pain at 6 out of 10. Tough old man. We admitted him to ortho to clean out the diesel and necrotic flesh. Next story. If my doctor was here, they'd say me. I put up with appendicitis for 5 to 6 days before just going to a doctor. I couldn't eat or sleep, was in constant pain, vomited multiple times an hour, but just thought I was ill and I'd be fine in a couple days. Long story short, I went into cardiac arrest as it exploded mid-surgery. I wouldn't have been operated on, but a slot opened up. If not for that, I would have died in my hospital bed. So yeah, pretty much unalived myself because I thought I'd be fine. Had to spend a week in hospital for a routine operation. Next story. When I was on medicine wards in med school, we had a patient with Zenker's diverticulum. It's essentially a weak spot in his esophagus. Kind of makes an outpouching where food and liquid get stuck. He can then regurgitate the food and aspirate, leading to pneumonia and other bad stuff. We were the primary team, and Serge was going to take him back to the OR on Friday. Thursday night, he eloped and no one knew where he went. He came back Monday to the ED and got readmitted. When we asked where he went, he said he was at a big food festival that weekend that he didn't want to miss. So he went. Instead of getting the surgery he needed, he left to go eat fatty and thick fried foods, which literally could have killed him. Yeah, so this is already the third or fourth story we've read about someone who should not be eating anything under any circumstances, and not only do they choose to eat before surgery, but they pick the nastiest, grossest, greasiest food, chili fries, fried food, right before the operation. Come on, guys, we got to be better. Next story. Not stupid, but just plain confused. Grandpa admitted for pelvic distension, pyelonephritis, and UTI secondary to urinary retention. Urologist places a Foley catheter in to relieve his bladder and drains 3 gallons of urine in one sitting. Grandpa gets a good day's rest and all goes well, until one night we find him standing butt naked in the middle of his room with his privates oozing a pool of blood at his feet and the catheter, with the balloon still inflated, clutched in his fist. He had a very calm, "What are you all looking at?" expression as we reacted in horror. His nurse quickly calls the urologist again, and he places another Foley catheter with orders for continuous irrigation and to transfuse a unit of blood. Kept him longer in the hospital than he really needed to be. Next story. My mom's current BF has oral and throat cancer. Guy literally has a stoma and no tongue. Was still smoking around 3 packs a day until recently. Mother-in-law got diagnosed with stage 3 lung cancer, quit smoking and drinking for a couple months. As soon as the doctor said her condition was improving, she went straight back to smoking and partying. Only took a few months for the cancer to get to stage 4 and spread to her liver, kidneys, and brain. She smoked up until a couple days before she died, and even then, only because the brain cancer caused her to lose control of her limbs and she physically couldn't hold a cigarette anymore. It was so sad to watch. I'm incredibly proud of my husband, though. He quit smoking with her to help support her and never started again, even after she did. Said he never wants our girls to have to go through that again. Next story. Not a nurse, but close. I'm a therapeutic radiographer. Use radiation to treat cancers. We tell patients to be careful with what products they use on their skin because it can react with the radiation and give awful side effects. We had this one patient who was a total hippie. Probably would be an anti-vaxxer if we were in America. Anyway, she was having breast treatment, and within a couple weeks, we noticed her skin getting really burned and breaking. We asked her whether she was using anything on her skin. Right at the beginning, we told her only to use simple moisturizers and to ask us if she wanted to use anything else. She was like, "I'm glad you asked." She pulled a pamphlet out from her bag that was about this miracle oil that supposedly treats cancer. She had been slathering it on every day, and because of this, the radiation was making her skin literally fall off. We told her to stop using this immediately, and that if she wanted to use it, she'd have to wait until after treatment. She got all heated and started telling us we were a product of the system, and we didn't want her to be actually cured of cancer by this oil, because then we'd be out of a job. She stormed out. The next day, we saw her handing out these pamphlets to every patient that walked into the department. She was refusing to continue with her radiotherapy, claiming we were only harming her and the oil will cure her. We had to get security to escort her out and get her doctor to sit down and talk to her. We then had to take the pamphlets back from our patients and give a big PSA as to why what she was saying was bullcrap. We never saw her again. Next story. Obligatory, not a doctor or a nurse. One time I went to the doctor for a terrible headache that had gone on for days without break. Was there right when I woke up in the morning. I got put on some drugs, went home, took them for a few days, no improvement. When I went back to the doctor, he asked how many I was taking. I said the maximum dose listed on the bottle. He said a side effect may be headaches. Next story. Contact lens wearers, please do yourself a favor and take out your contacts when you're told to. I had a patient who came in and she thought she scratched her eye taking her contact out. When we looked, she had a gigantic ulcer on her eye. Yes, like a canker sore that you get on your mouth can be in your eye. Ulcers, if deep enough, will eventually scar. Depending on where the ulcer develops, will determine if there's any long-term damage done. I would say if the ulcer was about 0.55 millimeters to the left, the patient would have lost some of her central vision. She already had 5 ulcer scars in that eye and 8 ulcer scars in the other. This was not her first rodeo. Turns out she sleeps in her contacts every night and throws them out about once every 3 months to save money. A year's supply of her monthly contacts was $120. That one office visit alone was about $100, plus about $200 for a tiny bottle of medication to treat the ulcer, not to mention a copay for her follow-up visits. Of course, she has no backup glasses and obviously can't wear the contacts with an ulcer, so she had to pay to get a quick pair of glasses made, about another $400 setback. Contact lens wear time is not set to make more money for the eye docs. Your eye will literally develop a sore to tell you that it needs to breathe. Please, help out your eyes. Next story. We see a lot of people who get a common rash like eczema or some other unspecified dermatitis who very sadly convince themselves that they have bugs or worms or other creatures in their skin. They dig at their skin, pour bleach on themselves several times a day, or even dig into the skin to try and dig these non-existent parasites out. In doing so, they hurt, sting, itch, and suffer more. Some isolate themselves from family and friends, fearing they'll spread a non-existent infestation. It's sad. Edit. Just want to clarify that EBOM's disease or delusions of parasitosis need not be meth, also associated with hypochondria, anxiety, depression, etc. Next story. A woman who I was taking care of in labor was having heartburn, and she was sucking on a Quickies to get rid of it. However, she was also sucking on the gas and air at the same time for pain relief, and she sucked so hard that she choked on the Quickies, and we had to call a code blue because she couldn't cough it back up. We eventually sorted her out, and she was okay and went back to laboring. She did literally exactly the same thing 10 minutes later, had to call a code again. This was one of the times I really wanted to be able to tell a person that they couldn't take their baby home because they were too stupid to be allowed to have children. Next story. Grandma was in hospital for heart surgery, sharing a room with a guy who was waiting for a lung transplant. Guy is out on the balcony having just one last cigarette when he was supposed to have quit months ago. Transplant surgeon comes in, sees guy smoking on the balcony, doesn't speak to him, but leaves, takes him off the transplant list, and kicks him out of the hospital. Next story. Neither a nurse or a doctor, but this is about my grandfather. He had to have one of his knees replaced, being in his upper 80s and all, but was in great health otherwise. When they did the surgery, there is an issue of him not having enough blood to circulate, so he needed several transfusions. The doctors weren't really sure why this was happening. It turns out he and my grandma had gone a couple days before to donate blood. Next story. It pains me to see diabetics eat foods that make their condition much worse. I think part of it is denial, but the other part is that diabetes can be silent for so many years. Blood sugars can be very high and causing terrible damage to several organs, but have no symptoms. Also, people with heart failure with symptoms of severe lower extremity swelling from bad circulation, and they don't seem to get that all the salt they eat can make it worse. Then they go against medical orders and continue to eat high-salt foods, don't elevate their legs because it's not comfortable, etc. I had my ankle swell up after a 12-hour shift where I ended up standing more than walking, and it freaked me out to the point that I asked for an EKG. I immediately started wearing compression socks and watched my salt intake. We have only one body on this earth, and I plan on keeping it in shape. Next story. ICU nurse took care of an 18-year-old who got into a fight with his mom about not letting him borrow the car that night. He got so mad he rammed his head into a wall, giving himself a brain bleed. He woke up out of surgery, and his mom had to prompt him to acknowledge the neurosurgeon who saved his life. All he said was, "Appreciate it." I caught him taking pictures throwing up gang signs in his craniotomy cap. Just so dumb. Yeah, this is dumb, but also, kind of funny. Someone saves your life and you're just like, yo, preach, good looking out. Throw us up a gang sign. What is that? Come on. Next story. Work comp adjuster here had a claimant completely disappear after a surgery was ordered. Fast forward 2 years and he gets an attorney who demands the surgery be approved now. After months of back and forth, we approve the wrist surgery. 2 days post-op, the police find him walking down a country road, blasted out of his mind on meth, ripping out his stitches. Apparently, he went on a meth binge and just tore apart his surgical site. Doctor dropped him, his attorney dropped him, the state basically closed his case. The last I heard, he was out of jail, grabbed all his meds from home, and disappeared again. Never followed up with the doctor. I cringe to think what his arm looks like. Next story. I don't consider this all that crazy, but it happens a lot, so I want to warn people against it. I used to work in the ED and would occasionally see patients who had had a bad fall several days prior and hit their head. Rather than go to the ED immediately, they usually choose to treat their ensuing headaches with a painkiller. The older generation seem to prefer aspirin. The thing about aspirin is that it's a blood thinner, so what would have potentially been a small concussion was then a life-threatening and often life-altering condition. Don't treat pain with aspirin. Next story. Oncology nurse here had a patient with a relatively treatable cancer fail to tell us about a herbal cure that his son bought for $300 a bottle. He was taking it while getting chemotherapy. He wound up basically shutting down his liver and kidneys, hospitalized for weeks and delaying treatment. So yeah, the cancer spread. System too weakened to resume treatment. He's dead, and all because of the snake oil cure. Sad that families spend hundreds to thousands of dollars out of desperation and wind up causing more harm/death. A-holes that promote these cures for profit need to be sued. Next story. Well, this gives me a chance to talk about a very tragic case. I'm a geriatrician, or as my 6-year-old son likes to say, an old people doctor. Well, one day, a very fit 94-year-old lady walked through my door complaining of episodes of dizziness and lightheadedness. Since she was still living on her own and was relatively independent, our nurse specialist sat down with her to review her life so they could give counsel on what help she would need, which things she could still do independently, and what things she should avoid doing. Surprisingly, she told the nurse that she was still doing all the cleaning in her house, including getting up on a small stepladder to clean her windows. Not surprisingly, we strongly urged her not to get up on ladders anymore, given her episodes of dizziness. 2 months later, I learned that she was admitted to the hospital after she fractured her hip when she fell down from the stepladder while cleaning her windows. After that, her condition deteriorated quickly and she died not long after that. Next story. Ophthalmologist here. Once we treated a patient who had a very severe corneal ulcer in his right eye. We tried everything to treat the ulcer. Antibiotics, aceclofir, antifungal, eye drops, everything we could. The ulcer would not heal. We asked the patient if he was using any other substance in his eye, such as corticosteroid drops, balmic anesthetics. We explained to him he could never use this kind of eye drops for his condition because they could make everything worse. He would always be empathic, saying that he'd never do such a thing. We then scheduled a corneal transplantation, even if it was a risky procedure, but it was the last chance we had. Then one day I was talking to him and he seemed very confused about the eye drops and their posology. I asked him to show me all the eye drops he used to explain their posology, one by one. And then he takes a bottle of ophthalmic anesthetics from his purse. I asked him how long he had been using those. He said that since the beginning of the treatment, he started using them to get rid of the pain, which means he's used those drops for basically 8 months, every day, 4 times a day. I asked him why he did that, even after we warned him not to do so. He said, "I thought you guys were exaggerating." Because of his crazy anesthetic use, he made a very simple corneal ulcer become a very severe one. His eyes ended up having a perforation after that, and a corneal transplantation was performed. After the surgery, he stopped going to our service, so who knows what he's doing to his own eye by now. Next story. He had chest pain, so he took some cocaine. He may or may not have been having a heart attack before he did the coke, but he was definitely having one by the time I saw him. Cocaine puts a lot of stress on the heart and can cause heart attacks even in healthy people. This guy ended up okay, but he either gave himself a heart attack or he turned a small heart attack into a much bigger one. Next story. Too many patients ignoring their condition until they can't. It's not exactly stupidity, but it's self-inflicted still. There's a saying where I come from that goes, "Whatever came by itself will also pass by itself." No, I mean, not always. I've seen so many patients with tumorous growths in their mouths, necks, and faces. They could have gotten it checked and taken care of a long time ago, but somehow, maybe shame, maybe fear, maybe ignorance, decided to wait it out. It's really tragic to see reality dawning on them. Next story. Not a doctor, but currently recovering from surgery. They put Jackson Pratt drains in my chest so it wouldn't swell up with fluid during recovery. Apparently, upon waking up from surgery, I was disoriented and agitated, ripped the drains out of my chest, and had to be physically restrained. I remember none of this, but it's okay because they said they won't forget me. For the record, I'm a really timid person in real life and can't imagine myself doing this. Next story. RT here. Dad clinicals at LTAC, a nursing home that can take trachs, catheters, vents, etc. Patient there was forbidden from eating orally because he could aspirate, anything other than air going into the lungs. We had a feeding tube, but squirreled candy bars, chips, crisps, and other non-perishables in his drawer. Every day he ate something from his drawers, and every day there would be a code because he aspirated it. On my last day, he drank Dr. Pepper and aspirated it, to the point they had to take him to the hospital. Last I knew, he had aspiration pneumonia and had to have a trach put in it due to him not being able to get off the vent. Next story. Medic here. I had a call where a man fell off his bike, went to the pharmacy to get some antibiotic ointment, put it on his leg at home, and promptly had an allergic reaction. When asked about medical history and allergies, "Well, I'm allergic to Neosporin, so I bought some Aspiration instead." Aspiration is one of the active ingredients in Neosporin. Next story. I looked after a man diagnosed with high-risk acute leukemia, gave him chemo, which basically destroyed his entire immune system and bone marrow to kill the cancer. He decided he simply could not give up smoking, so multiple times a day he would leave his room and go down to the bottom floor for a smoke. No big deal, except for the fact that when you've no immune system, you pick up the smallest of infections and they become life-threatening. Sure enough, he ended up getting severe sepsis and having to stay in ICU for a spell. He also left the ward once with chemo running IV, without permission. The cannula tissues and the chemo infiltrated into his muscle instead of the vein. Next story. So I'm pretty far removed from the front lines now. I'm a resident in a tertiary/diagnostic subspecialty, but even from here, we can get some glimpses of patients' less productive behaviors. Details omitted because I'm not on a throwaway. Presented a case at an interdisciplinary tumor board regarding a teenager with what was initially a localized cancer of bone in his leg. Supposedly, it was locally resectable, in a limb-sparing operation, no less, except that the patient and/or family opted for alternative treatments. Vegan diet and crap, you know the story. By the time I got involved, kid had distant metastatic disease. I haven't followed up on how he's doing. Also did an autopsy on a woman with metastatic cancer. Heard from the clinical team that she had a chronic limb wound. That was an understatement. The wound was about 10 centimeters of neglected tumor, with multiple metastatic nodules erupting from the skin everywhere. Chunks of tumor falling onto the floor as we moved her onto the table. Lady was medically naive, incredibly. You don't get to that point and not realize something is wrong without some magical thinking. Best part? Family wanted to sue because they believed she was medically mismanaged. Like, her tumor burden would have killed her within days regardless of management. Next story. Obligatory, I'm neither, but this story from college always cracks me up. My new dorm mate, when I was a freshman, started the year with a cast from a summer injury. He had it on for a week or two and had about another 6 weeks to finish when the semester started. From meeting so many people those first few weeks, and him getting annoyed being referred to as cast boy, and him coming to the realization a few weeks later that none of the college girls really digged a guy in a big arm cast. This thinking led to me and him one night after getting wasted, cutting off his cast about 5 weeks into his final 6-week healing process. All seemed good until my buddy went in a few days later for the final check-in, and the doctor letting my buddy know by taking it off a week early, he'd completely messed up the recovery process. He showed back up to school the next day with another cast on, that he had to wear again for a full 6 weeks. Next story. I'm not a doctor or a nurse, but a retired Navy hospital corpsman. I was on deployment in Japan with a Marine Artillery Battalion, 1st BN, 12th MAR, out of Oahu, Hawaii in 2000. On a relaxing weekend off, I was awakened around 0300 early one Saturday morning to a pounding on my barracks room door. It was common for my Marines to come find me should they require medical aid on our off time. Pissed off by being rousted awake, I opened the door to find one of my jarheads standing there. Eyes glossy and bloodshot, drunk as a skunk, butt naked with the exception of the red hand towel he was covering up his manhood with. "Doc, please help. I'm scared and it won't stop." After a very brief exam, the problem was obvious. First, the red towel was actually white, but had become soaked through. This young man had contracted a case of genital warts a long time before this night. Embarrassed to come see us at medical and thinking he would be in trouble, he kept it a secret. Naturally, with enough time, his case worsened and grew, literally spreading over a larger area of his groin and clustering as this condition does. Think cauliflower. You're welcome. Warts are also very vascular, so they bleed easily and profusely. Having filled himself with liquid courage, this young Marine took it upon himself to apply a little home treatment. He sat naked on the edge of the tub and went to work on himself to remove his many genital warts. His tool of choice? Nail clippers. Blood was draining down the side of the tub before he got to the point he became desperate enough to reach out. Naked, drunk, and bloodied. I wrapped a blanket around him and took him to our battalion aid station, BAS, just like that. Stay safe, people, and seek medical help early. TLDR, drunk Marine attempts to remove genital warts with nail clippers, ends up a blood-soaked mess before seeking professional help. Next story. I'm a nurse, and this is a story about my idiot self. Last summer, I picked a tick off my belly and rubbed some alcohol on it and went on with my life. Over the next few weeks, I had a consistent red circle where the bite had been, but I had been in the sun, so I didn't think anything of it. After about a month, I started having terrible stiff neck and ear pain daily, which I just kept brushing off to sleeping wrong. I ran a 10-mile race and woke up the next day exhausted, aching, fever. Again, I thought I just pushed myself too far. 24 hours later, circular red rashes on my joints. Show one of the docs I work with. Ask me how long I've had Lyme disease. Next story. Not a doctor, just married to a nurse. This one wasn't what they did to directly make their own physical condition worse. Wife had a patient at the end of life of AIDS, who confessed to, after being diagnosed years earlier, convincing as many of his many lovers that he had that they shouldn't bother with a condom, with the specific intent of infecting them. The number that he reported being successful with was sickening. Pregnancy wasn't an issue because he was gay, but I'm sure a decent number of his lovers were bi, so heads up on that. Next story. My mom's a nurse, and she told me about a patient she had that they were pretty sure had bone cancer. Her calcium levels were through the roof, and it was beginning to mess with her heart function, which is how she ended up on the tele unit with my mom. Several days had gone by, and they couldn't get her calcium level out with any treatment, and were having even more trouble finding where the cancer was. Her friend visited her, and my mom walked in to find them eating little chocolates her friend had snuck in as a treat. Turns out, they were the calcium chocolate chews. This woman had been eating nearly a bag of those every day. No cancer and no lasting heart damage, but a long and very stern talk about reading the label on things and telling your doctor everything. Next story. Obligatory, not a doctor, but I used to work at a high-traffic hospital cafe. We were in the lobby and mainly there for the benefit of visitors and beleaguered staff, but mobile patients wandered down as well. The sheer numbers of diabetics and cardiac patients sneaking down to get like 800-plus calorie Frappuccino knockoffs was incredible. We weren't allowed to say no to sales, but nurses and doctors would totally find out and pull their own sting operations on self-sabotaging patients. Next story. Not a nurse, but worked in a breast cancer clinic. Woman had a mammogram in 2008 that showed a small, less than 1 centimeter, cluster of calcifications, but no discernible mass or distortion. She's instructed to come in for a biopsy. Never shows. Never gets another mammogram. She comes into our clinic in 2015 with a primary complaint of unequal breast sizes and a right breast significantly firmer than the left. Imaging reveals a 14 centimeter mass in the right breast. Essentially, her entire breast was replaced by cancer. The saddest part of this was our oncologist believed that if she had done the biopsy in 2008, they likely would have either found an extremely early stage invasive tumor or possibly only carcinoma in situ. She likely would have needed a lumpectomy and radiation and may not have even needed chemo. She would have had a very high chance of surviving to her normal life expectancy. She died about 3 months after coming in. The cancer had spread all through her body. She was in her early 50s, who left behind 2 teenage children. Please, ladies, if the radiologist thinks you should have a biopsy, do it. Most come back normal, but if it isn't normal tissue, taking action early can save you and your loved ones a lot of pain and suffering. Next story. I'm a med student, and a year ago I had an internship. On my station, there was this one patient who had dementia and sometimes forgot where he was and why he was there. He was also incredibly racist and sexist, but that doesn't matter. One day, he forgot why he had a bladder catheter and ripped it out. No need to say, it bled like hell. When I entered the room, I honestly thought he was going to die. There was just so much blood everywhere. Next story. Stupid person, not doctor. Broke my arm skateboarding, went to doctor, and got a temporary arm sling/splint thing put on. Went skateboarding the next day and fell on it again. I quit after that day. After the cast was on, I went wakeboarding with it, snowboarding, and didn't want to be left out of boxing with my friends. Got tired of fighting one arm, so I threw the hardest uppercut with my broken arm, which had a cast. I don't remember what happened, but I felt the most pain in my life for a split second and woke up on the ground. Friends say when the uppercut landed, my legs buckled and I passed out. Probably did so much more damage to my arm. Well, I'm glad that you already said it in a self-deprecating way, but I'm also going to say it because it needs to be said. This was absolutely stupid, my friend. Come on, what are we doing here? Next story. Young Hispanic male, 22 I think, got diagnosed with HIV. Instead of taking his meds and putting in the time to take care of himself, he spent a year partying. Well, he came into our ER one night in kidney failure. He torched his kidneys and will now require dialysis 3 times a week for life. What frustrated me so much was that he had no money or insurance. He'd blown his savings and quit his job to party. So the state paid for all his treatment and continues to, as he'll probably live another 40 years. Next story. It's crazy how often patients present to hospitals seriously ill or dead after suddenly stopping their medications for mundane reasons. A relative or TV host told them to, and they ran out and didn't go to the pharmacy / they're allergic due to mild side effects. I've seen patients die of heart attacks and strokes after stopping blood thinners, or die of overwhelming sepsis after stopping antibiotics. More recently, a patient with brain cancer presented paralyzed on one side of his body after suddenly stopping his steroids. Please, please, please discuss stopping your medications with your doctor before you stop them. If you don't know why you're taking them, ask. And if they can't or won't, find a better doctor. Next story. Patient had a severe tooth infection. Tried to get the tooth out themselves. Tooth broke at the gum line, but the patient kept going for more and removed part of their bone, but not the remaining root tips. After 2 hours, they came to the urgent care bleeding all over the place and wanted the tooth to be extracted. Not only did the root tips have to come out, sutures were placed alongside bone filling to ensure proper healing of the removed bone. Next story. Happened last year during my training in surgical ward. A female patient came in after 2 to 3 weeks of bilateral mandibular lower jaw fracture and unilateral maxillary upper jaw fracture. The callus had formed and the jaw had incorrectly set itself in a healing pattern. The lady and her husband, both teachers, had thought it would have healed itself, but came due to pain and difficulty in mouth opening. Anyway, the lady had hypertension and diabetes. I strictly told her to stay on her medications and insulin, but stop taking fluids and food 8 hours prior to her scheduled surgery time so that we could perform the surgery the next day if all values were in range. Later that night, when I was doing my final round, first, the patient wasn't in her bed. Instead, there was another female relative sleeping. Second, after I tracked patient down, put her to bed, I took her vitals. Turns out she had been drinking artificial juices to get energy for her procedure due in the morning. Her sugar level was nearing 100 milligrams over DI third. She was taking fluids during her NPO, nil per oral, when patient isn't allowed to drink or eat, because she thought it was okay. Next story. I had this patient with congestive heart failure. Basically, for a whole bunch of reasons, you're not supposed to eat salt with CHF. One of the side effects of the condition and too much salt is fluid retention. He was this nice old Pennsylvania Dutch guy. I was his nurse when he was in for a CHF exacerbation. He was on our unit for 8 or 10 days strengthening and derusing, removing excess fluid. All he could talk about was eating deli pickles. We're trying to tell him it's bad for his health, and he insists on having some to only have enough to get a taste. We release him. He goes home and eats something like 4 to 6 whole deli pickles. For those who haven't had one, they're full-sized cucumbers. He was right back in the cardiac unit within 48 hours, blown up like a balloon. Next story. Well, my doctor would say me. I suffered for a couple of weeks with appendicitis, flew across the country, attended a wedding, then came back and got even sicker, which didn't seem possible as I was sleeping with 2 frozen water bottles on my right side. I went to the hospital. They thought it was my gallbladder because of the location of the pain. They did an ultrasound and my gallbladder was fine, and my appendix, well, they were thinking about putting it on a milk carton. They found the little bugger hiding in the area around the bottom of my rib cage. I really didn't know those things could move. Next story. My mom had congestive heart failure, the early stages, but was too stubborn to accept her condition and shopped for doctors until she got the answer she wanted, which was that she was fine. She wanted to drink. She always has. Several months later, she's put in the hospital for the same thing, in beginning stages of kidney failure. Once she heard dialysis, she checked herself out. A day later, my wife and I go to her house, and she's drinking a bourbon on the rocks with an orange wedge. Of course I was pissed, but I could only do so much. She was back in again. Same thing, exact same thing. And in the third time. She was then told she had to go on dialysis 3 days a week for at least 6 months while her kidneys healed, adapted, don't know. All this was in a matter of 3 months, 2 to 3 week stays at a time. She went back in a 4th time and her boyfriend said, quote, "She may have had some sangria and vodka at a party, but I didn't say anything." Avoiding all the anger that came of this, she finally died of sepsis, accompanied by kidney failure, liver failure, and something else with a retaining liquid thing. She died essentially from drinking while having a medical condition. She unalived herself, and I think she knew it. I too have an alcohol problem, but it's harder to stop now that this happened. I know, counterintuitive. At 28, I lost my mom. My wife was pregnant with our second kid, and I had one chance to tell her when she was coherent for a few hours, but I didn't because I was so angry with her. I'm still fighting the regrets 3 years later. Next story. I once had a man with substance abuse issues who basically just enjoyed being in the hospital. He came into the ED and was admitted for cellulitis of his foot. He was also a super uncontrolled diabetic. He had a foot ulcer that probed to the bone and had osteomyelitis, infected bone, on his foot as well. We kept him in the hospital for a few days, getting this ridiculous infection under control. Finally, he's stable enough to send home with close follow-up for wound care. He comes back, no lie, 6 hours later. The pharmacy had run out of the pain medicine he had been prescribed, and instead of taking his prescription to another pharmacy, there were at least 5 within a mile of the one he went to, he grabbed a 6-pack of beer instead, drank the whole thing, and then drove to his sister's house. While en route, he crapped himself, such that he got feces in his diabetic foot ulcer. When he showed up at his sister's house, she told him he was too drunk for her to deal with, and he needed to drive himself to the hospital. So he came back to us, drunk driving himself to the hospital with feces on his osteomyelitic diabetic foot ulcer. He lost the toe and part of his foot. TLDR, crazy drunk dude has bad infection in the bones of his foot. Pharmacy ran out of his pain meds, so he got drunk, pooped on his open wound, and drove back to the hospital drunk, all within 6 hours of leaving the hospital after being treated for the infection.